talk. Nobody can see you. Nobody knows you're here. And is Jackie back here yet? Okay. I'm going to double check to make sure we're good on Facebook here. Nope, I think we're good. Can you believe that, guys? I did it the first time. All right, we are good to go. So, okay, guys, I'm Dr. Jaime Trent. I think most of you know me. I think I know about everybody in here. So we're going to talk about mainly inflammation tonight. I'm going to explain what exactly is inflammation and how do we really need to address it. So I don't think I'm going to introduce, since I'm on Facebook, I'm going to just kind of tell a little bit about myself real quick. So I am a chiropractor. I've been practicing for 20 years this year. I started out just straight chiropractic and doing acupuncture, but found my patients really needed a lot more than just that. Our lifestyles are horrendous. We have too much stress. We eat the wrong foods. We're overburdened by chemicals. And we really need more to be healthy. So that started my journey into functional medicine. So I started looking into whole food nutrition, and that's just kind of evolved over the years. See, she said I'm already talking too fast. So that's just kind of evolved. And of course, when I really got into it was when I had kids. You know, that's when I really stopped and thought, okay, what do we need to be putting into our bodies? So, and then after that, now we've gotten in, like I said, detoxification, inflammation, gut health. You guys know I talk a lot about gut health. If your gut's not healthy, you're not healthy. So we'll kind of hit on a little bit of everything tonight. Like I said, as I go through and talk, please ask questions. I want to talk about what you guys want to talk about, what questions you have. There is no stupid question. I guarantee if you're thinking it, somebody else is thinking it too. So some of this is going to be pretty basic. Some of it's going to get into a little bit more depth. It's not that I expect you to really grab all of it, but just understand, you know, it is a process that we kind of need to understand, and we need to understand why we're changing our diets and our lifestyles. I think that's a big reason people have a hard time sticking to things. If you're doing it for weight loss, people they have a hard time just sticking to things. If you start doing it for health, it makes it a lot easier to make those changes. So before we really kind of dive into the information, do you want to introduce them first or just at the end?
Myself and then bring.
Yeah. Okay. We're just going to kind of, switch.
Yeah. So I know most of you also, Dr. Justin Fulk, Jamie's brother. I've been in practice the 18 years this fall. It's funny. She said that she never really took things to the next level nutrition wise till she had kids. Yeah. I got a 20-month-old, and when my wife was pregnant, she was never really involved in healthcare and nutrition or anything. And she went full on, and she was coming to me with things that I was taught in chiropractic college, that I was a single guy, you know, I ate fairly healthy. I did all, you know, whatever. But I mean, we took every chemical out of our house. I tell patients I make my own hairspray and mouthwash. I mean, we went extreme. And it was because we had a little girl coming, and we wanted to give her the best chance we could at having a good, healthy life. So because of that, I've started a certification into functional medicine. So it's it's a year-long course. I'm about a month into it. So so I'm going to start doing some of this with Jamie. I've referred patients to her for a long time with it, but I'm going to try to come and take some of those cases and specialize in ways to help her focus on other things so we can do more with more people. So so that's a little bit about me. I'm going to bring up the ladies of Isamia, and they've got some stuff here they'll tell you about. We just asked them to come because they've got some really good natural products.
So I'm Tanya, my name is Bella, and we are co-owners of Isamia. And I started making products for our family probably 20 years ago, about the time she was a little kid, piggybacking on what Dr. Justin was saying, really concerned about what we were putting in our bodies. I was now also concerned what I was putting on my body. And this little girl had a bunch of topical irritants and allergies.
Food allergies, like you would never believe, allergic to everything.
And eczema and whatnot. So we tried to go the pharmaceutical route. I quickly learned that those products were not very good for you. I started thinking, probably pretty naively, I could do better myself. And so it just didn't occur to me that I couldn't. So I kind of jumped in full force. And fast forward, we've created this business. One of our products is the topical analgesic. That's just a pain reliever. It's great for sore muscles, sore joints. It's all natural. There's no yucky stuff in there. And I think it lasts longer and it smells better. I personally like to use it for chronic pain. I have a lot of chronic pain in my neck. And then Bella likes to use it for something else.
Yeah, I played volleyball for about 8 years. So during tournaments, when I would get sore muscles or some kind of an injury, I would use Osteo Restore on that and it would actually reactivate. So when she started making it, she didn't know that it would reactivate. And so when we say the only animals that we test on are ourselves, so I was the little test monkey. And
Maybe it's a kid.
So I started using it for volleyball and realized in games, because I would be in 12-hour tournaments, every game when I had it on at the beginning of the day, it would reactivate itself with sweat. So that was another nice benefit.
Yeah, so I put together a little brochure you guys can look at later on, and then there's a little part on a little bit about our company, just a snippet. And you can visit our website and stock all of our Insta and socials and whatnot. And we have a newsletter you can sign up for. But I did bring some today if somebody would like to purchase one of our products. And today I am doing a buy one, get a sample size free. So I do have some that are filled up just sample size. And so you'll get one of those different formulas. There's 4 formulas free. And I'm open to questions if you guys have those at any time after. And I'm really looking forward to this class.
All right, thank you guys. Thanks for being here.
All right. Okay, I think we're ready to kind of get started. We got a few more people coming in here. You guys, there's anything else over there. So, all right. Okay, so we're gonna go ahead and get started. We're gonna jump in and talk about, does that look, that's what I thought. I've got something. Why is that on there? Sorry. Let me close. There we go. Okay, Jackie, do I have sound? Jackie?
That's what I'm.
Okay, double check. I think I heard it. We're just making sure we have sound.
Maybe we applauded too soon.
Yeah, I'm just double checking. Double checking. I think we should. It just gave me a notification, so. Is it good? Okay, so, yeah, there we go. Okay, all right, so we were gonna talk about how to fight inflammation naturally, so. Okay, turn it off now. All right, so first we're gonna say, what exactly is inflammation? So inflammation is when your body encounters an offending agent like viruses or toxins or chemicals, and sorry, let me close that down. And it activates your immune system. Okay, so your immune system sends out its first responders, which are inflammatory cells and cytokines. These substances that stimulate more inflammatory cells. So that's what inflammation is. So the cells that begin an inflammatory response, they trap the bacteria or other offending agents and start healing the injured tissue. The results can be pain, swelling, bruising, redness. But of course, we know inflammation can also occur inside the body where we can't really feel it or see it. So there's 2 main kinds of inflammation. We have acute versus chronic. So acute is like you bump your elbow, it bruises, your body heals, and it goes away. It's short term. Your body can kind of take care of that pretty quickly. Then we have chronic inflammation. So chronic inflammation is where this inflammatory process just keeps going. The body just keeps sending these immune cells to attack the area. So this in the long run can eventually develop into autoimmunity, to where your body is actually breaking down itself. It's actually attacking your own body. So why does this happen? So as we go through, first, before we really get into talking what to kind of talk about it, I want to kind of explain NSAIDs. So the medical treatment for inflammation is to block the inflammation, to stop the process. So now what little I just told you about what inflammation is, do we really think we want to do that? We want to stop our body from being able to attack viruses or bacteria or get those chemicals out. No, we want to allow our body to have inflammation because it's part of our healing response. But what we need to do is we need to help the body resolve that inflammation. So we need to start taking a different approach. So when we're looking at NSAIDs, so NSAID stands for non-steroidal anti-inflammatory drugs. Okay, those are the ones like ibuprofen, aspirin, naproxen. So those are the ones they are just blocking that inflammation. So the problem with these are, number one, you should never take them long term. ever. They were never designed to be taken long-term. You should probably take them maybe 2 weeks at the most. So for example, I mean, ibuprofen is the biggest one. It will cause stomach ulcers. So if it's taken long-term. So then, of course, I just kind of threw painkillers in there just to explain real quick. Acetaminophen is one that a lot of people take. Tylenol is a name brand. That one's not really even an anti-inflammatory. It's just a painkiller. It actually blocks the pain in the nervous system. So it's not doing anything to help resolve the actual problem that you have. It's just blocking the pain. So none of these are really helping your body deal with the problem. So resolving inflammation. So what does this mean? Originally, we thought this was a passive process. We thought that the body just resolved it and it just, you had that inflammation go and then it just stopped. But what we've actually found with more research is a study in 2000 actually revealed that it's actually an active process, that we need something to actually put the fire out to calm that response. And these are actually called specialized pro-resolving mediators, okay? So the source of these, the best source, is from what we call PUFA, so polyunsaturated fatty acids. So the main two, there are more than just two. The main two we're going to talk about tonight are the omega-3s and your omega-6s, okay? We need both, but we need to make sure we have a balance of these. So your omega-3 fatty acids are anti-inflammatory. Most people at least heard of that, right? Okay, so anti-inflammatory meaning they resolve the inflammation, okay? Your omega-6s are pro-inflammatory, so they promote inflammation. Okay, so you can already see, everybody understands why we already need both of these, right? We want to promote inflammation to start the healing process. Then we want to say, okay, it's healed, time to calm down. Okay, so this is usually kind of that thing that's missing with this chronic inflammation. It's not able to be resolved. Now, of course, I am simplifying things. I mean, there is a lot more going on here. You got to kind of make a lot of different changes and things, but we're just kind of talking about the mechanism. So and it with the standard American diet, so most diets the typical person eats is very, very high in omega-6s and pretty much no omega-3s. So that's going to be one of the big things. So omega-6 fatty acids, where do these come from? So like I said, we want some of these, so we want to get them from the good sources. We want to get the nuts, the seeds, the eggs, the grains, grass-fed beef, different things like that. But we have a tendency to get it more from your processed and prepackaged food, which also will have a lot of trans fats. The processed oil, such as soybean oil, canola oil. So you can understand that this is like most people's diets. It's all they ever consume. So your omega-3s, like I said, resolve inflammation. Your best source is going to be fish oil. So how many people eat fish regularly? Okay, some people do. Look good. See, these are my patients. That's good. So yeah, yes, I admit I'm not gonna lie. I can't. I mean, if you get good fish, it's one thing, but my kids hate it. So we don't eat very much fish. I go in spurts. I like salmon, but we don't eat a lot. So, but I know that it's the best source. So we do all take a fish oil supplement just to kind of fill in the balance. So, but consuming cold water fatty fish such as salmon, cod, sea bass, it has to be cold water fish, fatty fish. Tilapia is one that most people have a tendency to eat and think they're giving themselves benefit. You're getting no benefit from tilapia. You're actually getting more omega-6s than you are omega-3s because all tilapia is farm raised and all they're fed their entire life are grains. So that's going to increase the omega-6s in the fish. So tilapia and different things, you need to make sure you're getting the right type of fish. So, but also just taking a high quality supplement, which we are going to talk about the difference in the supplements. So other sources, plant sources, you can get some omega-3s from plant sources. The problem here is your body has to convert. So it's not going to be as effective at balancing this omega-3 to 6 ratio as getting it from fish oil. Can you guys see this okay up here? I'm going to turn the line off. It's good. Okay.
Is tuna considered a fish?
Yes, it's not quite as high in omega-3s as like salmon and things, but yes, it has omega-3s in it because it is a fattier fish. So all right, so okay, so omega-3 supplements, they are not all created equally. So the active ingredients in your omega, so if you look at your fish oil supplement, does everybody have a fish oil supplement in here, at least bought one before? Okay, if you look at it, they're usually saying like there's 1,000 milligrams of fish oil in your supplement. That tells you absolutely nothing about the effectiveness of your supplement. It's all about the EPA, DPA, and the DHA. So those are your active components in your fish oil. So EPA and DPA are better for your anti-inflammatory aspects. So they're gonna help resolve that inflammation more. DHA is better for neurological, brain, eye development, things like that. So, for absorption with different fish oils, the triglyceride forms are going to be better than just your normal fish oils. And it'll usually say that on the label. So, and the big thing about the triglyceride form is you need bile to absorb fats. So bile has to do with gallbladder. Gallbladder stores bile. So if you've had your gallbladder removed, you're probably not digesting, absorbing fats as efficiently as you maybe were once. So triglyceride forms, I find with people, even if they have gallbladder issues or don't have gallbladders, they still absorb this better. So that's another benefit to the triglyceride form. Okay, so with omega-3s and omega-6s, it's like I said, it's all about balance. I just kind of threw this one in here. We can, like I said, we want to get our omega-6s mainly from these sources up here. Meats, there's a big difference between conventional raised meats and your grass-fed meats. So like I just mentioned, like with the tilapia, if they're fed grains their entire life, they're going to be higher in your omega-6s because grains contain omega-6s. If a cow is kept in a feedlot its entire life and never out on grass, same thing. Its meat is going to have more omega-6s. That's why it's going to be more inflammatory. If you've got a cow that's actually been out on grass most of its life, it's actually going to be higher in omega-3s. So just like in our body, it's going to have more of a balance between the omega-6s and the omega-3s. So it's going to be better for us and less inflammatory. Same thing with eggs. So eggs are going to be the same way. If you've got a chicken that's literally never seen the outside, it's going to be higher and it's been fed the grains and things. Same thing, higher in omega-6s. If it's been able to go out, eat grass, bugs, and a wide variety of things, it's going to have more of those omega-3s plus a lot of other nutrients. And if you know, with an egg, if you get like a local egg compared to just a regular store-bought egg, you know, you'll crack it open and it'll be this pale yellow. But then you get one from your neighbor and it's like orange. So you want it to be orange. You know, that's why it's got a lot more nutrition. It's got choline, it's got folic acid, and it's got everything you need in it. So, but like I said, when we're talking about omega-3s and 6s, we need this balance. And I think I've got it on the next slide though. Is there anything else I want to cover on this? I think we're good there. Yeah, my order slides got off. So we'll just go ahead and talk about the label. So this is just a label. I just got off the internet. I don't even know what company it was. So this is just an example of the label for a fish oil supplement. So when you're reading the labels, the thing you need to look at is number one, you need to come down here and you can see, yes, see here it says fish oil concentrate 1200 milligrams. So you think I'm getting quite a bit of benefit from that. So, but then you drop down here and you see the omega-3. You can see here the omega-3 EPA is actually only about 360. The DHA is only about 300. So you're actually only getting about 660 of benefits, of milligrams of benefits. So that's not nearly what you think you're doing. So this next one, again, looks pretty good. You know, you kind of says it has all the good stuff, no color added, no artificial flavors, gluten-free, all this stuff. You come down, fish oil, 2000 milligrams. You're thinking, wow, this one's really great. Drop down here. Well, total omega-3s is only 600, but then you drop down even farther. We've only got about 500 milligrams in that that's going to be beneficial. Then you go back up to the top. That's in two soft gels. See how tricky they get? They get tricky. So you'd have to know what you're looking at to know if you're getting anything that's going to benefit you. So I mean, you are getting barely anything in these. So I mean, you would have to take 6 a day to even get any benefit from that. So you need to understand. And fish oil supplements are tricky. I've been for years talking to people how to read. I usually just say, just send me a picture. It's just easier. So then this is an example of a triglyceride form fish oil. So we're going to look at it again. So took right here, this is your total omega-3s. It's not fish oil, it's your total omega-3s. So this is 950. This thing is not working. There we go. So, and it is as a triglyceride form. So when you see that, the absorption of this fish oil is going to be almost twice of what a normal fish oil is going to be. But then you drop down here, your EPA is 430, your DHA is 390, and then we've also got this added DPA, which is also beneficial. So in there, you're getting about 850 of active ingredients in one soft gel. Okay, so that is the difference with fish oil supplements. That is why going to Walmart and grabbing whatever is the cheapest may not be doing you any benefit. Then on top of it is if they are not processed properly, most of them have been at least, don't usually have chemicals, they've been purified, all that. But if they're not stabilized, they can go rancid and become putrefied. Yeah, 50%.
And if you can't take fish oil, what do you, when there's an alternative,
Why can't you take fish oil?
acid reflux?
We need to talk.
Okay.
So what that's telling you is that your digestion is not working well enough to digest and absorb fat. So that's why if you get any digestive complaints with a good quality fish oil, now if you're taking a cheap one and you're getting the fishy burps, I tell people cut it open and smell it. If you cut it open and you smell it and it smells like a dead fish, it's gone bad. And you don't want to be taking it at all.
Was it you, if you put it in the freezer and it freezes, that's not good, right?
I've heard that.
I don't know about that. I know a lot of people will put it in the freezer so they can take it so they don't get burps. So I don't, yeah. Again, if you're burping, you've either got a bad fish oil or you've got bad digestion. So you're not absorbing it. So you need to kind of address either one of them. And that's why I said with the triglyceride forms, I find that people do not usually get the burping as much because they can absorb it better. So even though we're doing pretty high doses, they don't have any problem. So I really, the triglyceride form, since I've started using it, I haven't had hardly, I don't think I've had anybody having issues with it. So, but yeah, so yeah.
Do you recommend taking it with food, not with food, morning, evening, does it not matter?
Not matter.
Okay.
No, doesn't usually matter. If you have issues with it, I mean, you can take it with food, but really, I mean, it is a fat, so it's gonna pretty much stimulate the bile flow to absorb it anyways. So like, there's some supplements that are better absorbed when you take it with a fat, so I'll take it with my fish oil. So like Boswellia complex, which we'll talk about a little bit. So I usually take it with a fish oil and we get better absorption. So yeah, so not necessarily, so. Any other questions on that? Did I cover everything? I think I covered everything I wanted on that. But it's not hitting well. So yes, so if you've taken it in the past, get the burping, that's usually an issue. But literally, I have done it in the past, I'll break them open and I mean, you can smell bad, really bad. So they'll stink pretty bad. Okay, this was the slide I was looking for before. So healthy inflammation response is all about balance. Okay, so we've talked about we need omega-6s, we need omega-3s, but we need them to be balanced. But surprisingly, we still need a little bit more of the omega-6s than the omega-3s. Now, I've seen some research that some doctors are recommending to get this ratio to about 1-to-1. But really they're saying if you get about 4-to-1 ratio of omega-6 to omega-3s, you're doing pretty good. So, and that means, so if you weren't looking at it and consuming it in your diet, you want to be consuming 4 grams of omega-6s to 1 gram of omega-3s. So that's just kind of giving you an idea.
And I believe the standard American diet averages like 20 to 25.
Oh, it's like
20,
it's like 80-1. It's about 80-1. They're seeing, yeah, so people that have run these tests on patients, they're seeing like 80-to-1 ratio. So I mean, yeah, it's pretty bad. So I hopefully none of you are that bad. So hopefully all of you listened to me some over the years. So okay, so now we're going to go in and talk a little bit more about different I don't want to say diseases, but different pathologies and things that can be helped by omega-3s. The first one we're going to talk about is how it really affects us at a cellular level. So this is just a picture of a cell right here. This dark blue circle around here is going to be your cell membrane. Your cell membrane is actually made up of fat. Okay, so if you have plenty of omega-3s, you're going to have omega-3s in your cell membrane, which is going to allow your cell to be more fluid. So it kind of allows your cell to basically work better. So the way the cell works is things need to be able to go in and out as they need to. So if it's more fluid, it's going to allow that to work better. I swear this thing always works when I'm practicing and it never works in class. There we go. So our body just works better at a cellular level in an abundance of omega-3 fatty acids. So this is one of the reasons it helps so much with our brains. So the new research is showing that depression is really linked more to inflammation. So the common belief was that depression and anxiety were more a neurotransmitter imbalance in the brain. So now what they're actually finding is that it's more the chronic inflammation that is causing your brain to not be as receptive or sensitive to those neurotransmitters. So just what I just showed here. So what happens is we may have those neurotransmitters in the brain, but they're not able to get into where they need to affect you. So they're not doing you any good. Does that make sense? So we need to take a different approach. Again, it's about treating the underlying cause instead of going in and trying to treat the symptom. Is that new to everybody about the depression? Okay, that's pretty new. So yeah, so that's one I think that a lot of people still don't know. But yeah, so always need to treat the inflammation. And that's why they're also finding that serotonin SSIs, the reuptake inhibitors. They're actually thinking that they've been working for people more because they reduce the inflammation in the brain other than blocking this uptake of the serotonin. So that's what they're kind of finding. The other thing with omega-3s, like I said, your brains just work better when you have an abundance of omega-3s in your body. The other thing is they heal faster. So if you've got a kid or anybody who is doing contact sports, you want to make sure they are on an omega-3 so that they can recover from the concussion. Or if they've had a concussion, you need to start pushing the omega-3s. There is tons of research on this, tons. So omega-3s are very important. And I think this is the biggest reason everybody knows. A lot of people, suicide is a huge problem right now. And on most of these, if you look into the history, there's usually a head trauma. And the reason is the brain was never able to recover from that trauma. And this is one of the reasons why. So again, there's another reason we've got to start talking about this. All right, so gut, you guys know I always got to throw gut in there, everything I talk about. So, all right, so leaky gut. Just to explain what it is real quick. So leaky gut is basically, we have all these cells that line our intestines. So leaky gut is when we start to get kind of a breakdown of these cells. So we have these tight junctions that kind of hold the cells together. Once these tight junctions start breaking down, food particles, bacteria, and things that aren't supposed to get from our gut into our blood start getting there. So then that kind of sets off not only our immune, well, it sets off inflammation. And it can cause also autoimmunity, like I just kind of mentioned before. So that's kind of the most extreme. So, but the tricky thing with this is inflammation. You can kind of see how this just kind of goes in a circle here. So once we start getting intestinal inflammation of the gut lining, this can be from our poor digestion that can't break down proteins. It can be from eating foods that our immune system is reacting to. It can be from stress. It can be from not sleeping enough. It can be from not eating the right nutrition. But once we start get that inflammation, we start not being able to absorb our nutrition as well. Then we start getting this immune response, which in turn causes more food intolerances, more gut issues, which eventually causes this autoimmune, and causes more inflammation, and we just keep going around and around and around. Now, this can start at any point in here. We could maybe not be eating enough. Maybe we're eating a very highly processed diet and we're not getting the nutrients that we need to support our gut lining. So it starts breaking down, then the immune system starts attacking it, and then we start going. So it's not that we start, and that's why this goes around and around. You can start at any point, or maybe you have an autoimmune disease from something else, but it starts the intestinal inflammation and on and on. So that's why we've always got to get in there. The inflammation is always going to be involved. So, any questions on that? I just wanted a quick one on that. Okay, arthritis. This is one I think, so arthritis, that word just means joint inflammation. That's all it really means. So when most people think of arthritis, what do you think of? You think of what? Pain, but also degeneration, right? Most people think I have pain in my joint because of the degeneration, right? That's what you think, because I'm old. That's what I always get 30-year-olds in my office saying, oh, I just thought it was arthritis. I'm like, oh my gosh. So, but no, so it's really the opposite. Arthritis and joints start breaking down. Yes, when we've got a trauma, when we age, they're going to degenerate some. But it really starts, the inflammation is what actually causes most of the joint degeneration. So you could take 50 people and none of them have low back pain. And you can x-ray all of them, and probably over half, if they're over the age of 40, pretty much all of them are gonna have some degeneration in the low back, down in that disc, all of them. But doesn't mean they're gonna have pain. So that's the thing, it may be there, it may not. The factor that's gonna cause the pain is the inflammation. So it's not just the arthritis, it's not just the degeneration, you've got to get the inflammation under control. And I've seen this over and over with my patients, they'll say, okay, I'm bone on bone in my knee. But you know what? We get them on some turmeric, we get them on some glucosamine, we get them on some things to just calm the inflammation. And they're not that, yes, they still need to have replacement, but at least they can deal with the pain and they can actually sleep at night. We get them through until they actually get the surgery. So it's not, does that make sense? Because I think a lot of people don't understand arthritis and they just assume once I have it, there's absolutely nothing I can do with it other than take pain blockers or anti-inflammatories or things.
That would be also a lot of patients that come in with back pain or a shoulder pain. They say, oh yeah, I got an x-ray and I've just got arthritis. So when did the pain start? About 2 weeks ago.
Yeah.
Well, if you've got arthritis, that's been there a long time. Arthritis takes years to develop, especially to get bad. So what I tell them is like before 2 weeks ago, you had your arthritis, they didn't have pain. So I would say arthritis does not equal pain. You can get a lot of function from really arthritic. And so that's
Yeah.
one of the misconceptions about arthritis.
And arthritis is another catch-all.
It's-
I say if the doctor doesn't know what else to do with you, you've got arthritis or you've got fibromyalgia, one of the two. And that's it. And that's it. And then you accept it, that's your diagnosis, and you live with it. But that's not the underlying cause. That's just the group of symptoms that they can't said you fit into this, so go away. I mean, I hate to put it that way, but that's kind of what it's come down to. So, and it's not their fault. They are not trained to deal with complex processes in the body. They are trained to say, you come in with this symptom, and I've had doctors literally tell my patients this. They say, I am trained for you to come in, you tell me what your symptom is, I give you a drug for that, and I don't address anything else that's going on with you. Is that what you want? That's not what people want, that's not what they need. You are more than your acid reflux, you are more than your high cholesterol, and I'm gonna get all quiet. But it's frustrating. I have so many patients come in my office and they're so frustrated. And sometimes it's so simple. Sometimes they're just not sleeping enough. Sometimes they're like thinking 5 hours of sleep is enough. No, you women especially need over 8 hours of sleep every single night. Our adrenal glands need that time to recover. We have to. Men, they can get by with less. We need times of relaxation. We need time to recover. We need time to do things that we enjoy. So I talk a lot about nutrition and all this, but it's all of it. We have to look at all of it. We are more than just pain or inflammation. Or
Can we set doctor's
so-
note so we can give it to our
Yeah,
husband?
yeah. This is gonna be, that's a recording.
Tell the doctor,
Yeah.
the next two.
Yeah, this is recording. You can just have me watch it. It's recorded. There you go. So, all right. So like I said, almost everyone over the age of 40 has some amount of joint degeneration. So it doesn't mean they have pain. I guarantee if you went and x-rayed my low back right now, I'd probably have degeneration. I know I probably have some degeneration in my left knee, but it only bothers me if basically if I do kickboxing and turn it. So as long as I keep that inflammation under control, it doesn't bother me. So cardiovascular disease, another one. So what do you think of when you think of cardiovascular disease? What's the first thing that kind of pops in your mind? What's cholesterol? Cholesterol is usually the number one thing. Again, guess what? Cholesterol is not the cause of heart disease. It is the symptom. Guess what the cause is? Inflammation. So the reason your body starts producing more cholesterol is because it is trying to fix something. So cholesterol is, so with your arteries, if you have anything, let's just talk about it in the blood sugar is kind of just an easy example. So say you've had elevated blood sugar for a long period of time. That is literally like having shards of glass running through your veins. So it's constantly putting scratches down your arteries. So the way your body fixes this is it mobilizes cholesterol. First, it mobilizes LDL. So that's everybody's heard the bad cholesterol. So mobilizes the LDL. So the LDL is big and bulky. So it comes and it sticks to the side of the artery. Okay. So then what's supposed to happen is your HDL, your good cholesterol, is supposed to come by, smooth that down, take the excess LDL back to the liver to get rid of it. So that's the normal process. So that's kind of where the good and bad cholesterols come from, because every time they find plaquing or clot or anything, it's LDL, because that's what was there. But that's a normal process in our body. So now when you overeat sugar, carbohydrates, and things like that, that LDL goes up because your body's trying to fix something. Okay, does that make sense? So inflammation is the reason the cholesterol goes up. So in a lot of times for a lot of people, blood sugar is the fuel to the fire. Basically, that's what starts it. So again, if you get put on a statin, it's treating the symptom. And they've shown, there's tons of studies again out there showing taking a statin does not reduce your risk of a heart attack or stroke. Does not at all. There are so many studies out there. I actually read one, the way it was worded, I can't remember how it was worded now, I should have put it in here, but I mean, it was like a study done and it reduced, like people taking a statin compared to the group not taking a statin, it basically reduced by like 5.
Yeah.
I didn't
It's like.
It's ridiculous.
Like 5.
It was ridiculous. And
And that, and also people going to an emergency room having a heart attack, about half the people have high cholesterol and about half have normal to low cholesterol.
Yeah.
So the amount of cholesterol circulating in your bloodstream has 0 to do with having cholesterol.
And if people understand the true risks of taking a statin, they probably wouldn't be taking statin. I mean, it causes your muscles basically to break down. If you start getting any type of muscle weakness, fatigue, pain, I don't care if you've been on that statin 10 years, you need to get off that statin. It depletes the CoQ10 in your body and your body muscles cannot work. And you guess what? Your heart is a muscle. Your heart, whichever side my heart's on, it can't work without that. And that statin is just constantly depleting that CoQ10. So statins, and they lower your vitamin D too. I mean, you need cholesterol to make vitamin D. If you've got low cholesterol, especially if it's below 180, you can't make cholesterol, you can't make cortisol, you can't make testosterone, you can't function, your brain can't work. That's another thing with LDL. They're trying to push this LDL down to like where it's almost nothing. Your brain needs LDL. Alzheimer's, you need LDL in your brain. That's what kind of helps your brain function and things. So it's so much more complex, and this treating symptoms does not work. And I think all of you guys in here, that's why you're here. You know, treating the symptom doesn't work. You got to ask, what is the underlying cause? So, all right. Did I cover everything now? I kind of covered. So elevated blood sugar and or insulin resistance. Insulin resistance is type 2 diabetes. It increases your inflammation in your arteries, and I kind of explained that already. So any questions on that? That is a big one people don't get. So, and this is just a diagram that kind of shows it. I think I kind of covered it already. So, I mean, coronary artery disease, like I said, we got a fire going on in the veins. The body's just trying to put the fire out. It's using cholesterol to do that. The things that fuel the fire, insulin resistance and the systemic inflammation. So type 2 diabetes, taking in too much fructose and refined carbohydrates. And then of course, over here, we can see the suboptimal omega-3s and too much omega-6s. And then once you get all this, of course, you start getting high blood pressure, and that's called metabolic syndrome. When you've got the big three. Syndrome X is actually what they're kind of all the same. But high blood sugar, high blood pressure, and high cholesterol. So it's just, they all go together. And guess what? They're all being fueled by the inflammation. So.
I have a question on cholesterol.
Okay.
Why do we wanna measure, and what is the, the target number is not necessarily what you wanna look at, is it more about a ratio?
It's about the ratio, yeah, okay. So yeah, when you're looking at cholesterol, you want to look at your total, but then your total triglycerides are another one, and then we didn't really talk about triglycerides should be about half of your total cholesterol. Then your LDL should be about 100 points less than your total cholesterol. That's the ratio. Is that kind of what you're looking for?
Yes.
Yeah. So so LDL is 100 points less than total cholesterol. Triglycerides should be about half. So that overall means that you're you're okay. I mean, that means your body is working properly. Now, of course, you need to make sure your HDL is also in the normal range. But yeah, so as long as you've got that normal ratio, and some medical doctors are waking up to this, they are starting to look at this. But there's still some, they want to get that down as low as possible. But yeah, if you've got that ratio, I don't really care how, I mean, as long as it's your total cholesterol is not above 300, 350, then we're talking like family history and stuff. As long as it's not too high, I'm good with people with 250, you know, as long as their LDL is 100 points less and the triglycerides are half. I'm good with that because that's your body's normal process. And of course, the fact that we don't have any other inflammation or anything going on. All right, any other questions on that? Okay,
We talked cholesterol for a long.
we could use this, it's a topic, yeah, it gets us fired up, so. All right, so foods that cause inflammation, so sugary foods, we all know that, right? Please tell me everybody knows this by now. It definitely causes inflammation, it impairs your immune system, it blocks the ability of your cells to get vitamin C in to fight viruses, it feeds cancer. Sugar is bad. Now, I'm not saying you absolutely can't ever have sugar. You just need to make sure you're keeping it under control. And it's very easy to get sugar in every single meal if you're not watching for it. So, saturated fats, you still need some saturated fats. It's just when we're overeating saturated fats that we run into problems. And with dairy, you know, if you know that you can't digest dairy, you get gassy, you get bloated. You don't want to be eating that. That is causing inflammation. So we need to be staying away from those foods that we know cause problems. Now, if everything causes a problem, well, we need to fix the gut. We need to support the digestion. So, trans fats. So, are everybody familiar with trans fats? Do we know what those are? Okay, trans fats are fats that have basically been modified or changed. They're man-made fats. So these have been linked to cardiovascular disease because they increase inflammation. The government actually came out several years ago and said, okay, we need to start taking trans fats out of processed food. So they did. They actually started taking it out. Doesn't mean it's not there. So what they did is they got tricky with the label. Where's Anita? Anita's the one who told me this. So they got tricky with the label. So as long as a serving has less than 1 gram of trans fats, they can still make it. So what they did is you guys have noticed before, they'll start decreasing the serving size. So if you're eating like 5 different foods in it that may have less than 1 gram of, you could still be getting a decent amount of trans fats
But
a
you're
day.
probably also having 5 servings of it at a time because
Yeah,
the servings
exactly.
are so small.
Yeah, so you could be getting 5-10 grams of trans fats, even though it's not on the label.
One thing I noticed, I brought to her attention because the company I work for has a lot of food labels that she's talking about is when we started adding trans fat to all the labels, a lot of them had 0, but the calorie counts went up, or the cholesterol count went up, or the
Yeah.
carbohydrate count.
Yeah,
went
so
up.
they just kind of,
So
yeah,
there was, they changed it somewhere, so it was probably in there, they just
Yeah.
changed something else.
yeah, so they know how to hide it, they know how to, they're sneaky on stuff, so. But it made fast foods though, still, if you're eating fast foods, you're getting trans fats because they're using these oils over and over again. They're cooking the French fries in them. Whenever a oil is heated past a certain point that it's smoking, it turns into a trans fat. So same thing, if you're cooking at home and you're using like olive oil and you're putting it in there and it's smoking, that just turned to trans fat. So you need to make sure you're watching when you're cooking with your oils at home and using the proper oils that are better to be cooked at higher temperatures. So like coconut oil is going to be more stable and have a higher smoke point than like olive oil. And then avocado oil is actually a pretty good one. Grapeseed oil is pretty good. So you just got to know what oil to use for what. So olive oil, it's still okay to cook with, but a lot of times you want to just mix it with the food. You don't want to put it in there and heat it up before you use it. So
But even when, like, what if like the coconut oil, if it starts.
if it starts
that got
smoking,
too hot,
yeah,
same
it's
thing.
too hot. Yeah.
Mhm.
Yeah.
Yeah, they have like, different oils have like smoke.
Smoke
don't
point.
they? So
Mhm.
if you look into, you can
But-
find the temperature that they're
Yeah.
designed to go up to. Anything higher than that, you need to get a different oil or coconut oil.
I like my stuff burnt sometimes. Too.
Well, you can burn it, just don't, if you put the food on before, that's fine. So.
I don't, yeah, I guess that's more on the smoker, right?
All right, okay, so excess omega-6 fatty acids, we already talked about, but like corn oil, sunflower oil, vegetable oil. Now, some of these are, you know, like sunflower oil, it can be healthy and it can have some of the good omega-6s in it. But a lot of processed food, what they do is they use the processed oil also. So you want to, if it's an overly processed food, you don't want to be consuming it at all. So, but corn oil definitely high in omega-6s and very inflammatory, and you know, just your vegetable oil. So, refined carbohydrates, we've hit on that. There's not only going to have very little nutritional value, going to have a lot of calories and also usually a lot of chemicals added to it. Alcohol, MSG, which is also a neurotoxin, by the way. And if you have any food intolerances, like I just mentioned, if you know a food bothers you, if you know you're gluten sensitive, you know wheat makes you bloat, you need to stop eating it because it's causing inflammation, which is causing your gut to break down, which is going to lead to leaky gut, and which can eventually lead to autoimmune. Okay, so we need to start listening to our body and paying attention. So. Lifestyle factors, like I said, I talk a lot about diet, supplements and things, but these are equally important. This is the foundation for your health. If you're not sleeping enough, it's nothing else is going to matter. If you're not getting up and getting active, moving, we cannot sit. Studies have shown sitting for more than an hour at a time is actually more toxic for our bodies than actually smoking cigarettes because of our lymphatic system. That's how the lymphatic system is how our body basically gets garbage out. It only moves when you contract your muscles. So you've got to get up moving. Even if you just get up and walk to the bathroom every 30 minutes, it's all you need. Just make sure you're moving. Exposure to environmental toxins. This is one I have hit on for years. That's why we do detoxification programs multiple times a year. We're exposed to toxins every single day. Every breath you take, food you eat, drink, you've always got toxins going in. And our ability to detox is not as good because we don't eat the proper foods to support detoxification. So we've got to deal with that because that's just increasing the inflammation. Chronic stress. We've got to just stop and smell the roses. We've got to enjoy life. If we have these elevated stress hormones, cortisol, epinephrine, that increases inflammation over time. It's kind of a tricky one because actually cortisol initially decreases your inflammation, but it gets a little more complex when it's more chronic. Eating foods that are highly processed trans fats. All right, I think this is so. I'm going to turn it over to Dr. Justin for a few minutes.
I just got a couple things. So again, I'm just getting into a lot of the stuff that she's talking about. So I was going to hit on the chiropractic side of things. So I didn't put much on here, but I found this from a website. I thought it was pretty good. So the primary purpose of chiropractic care is to realign the vertebrae in the spine, to reduce pressure on the nerves, promote a healthy nervous system. A lot of people that see chiropractors, they know that we focus a lot on the pain aspect, but the nervous system controls our entire body. If you got interference with the nervous system, your body doesn't function right. So when the spine and other joints are properly aligned and the nerves function as they should, your body's biomechanics return to normal. And then this stops the production of neuropeptides, which can help reduce inflammation. And I'll kind of get back to that a little bit. I found a study on this. So chiropractic adjustments have been found to help reduce the production of cytokines and their proteins that regulate the cells of the immune system. When the cytokines build up, they can cause a severe inflammatory response. The preliminary studies suggest that chiropractic care may not only help with the affected area, but other parts of the body as well. So there's a study they did. Was there a separate slide on that part? I know I had a bunch. I don't know if you put it about is it here? Yeah, that was it. Yeah. So the study showed that 9 chiropractic adjustments, and it was over a 2-week period of time, reduced CRP, the C-reactive protein, and IL-6, which is interleukin 6, suggesting that chiropractic care is capable of reducing the inflammatory response. And again, it's not just in that area, but around the body. So interleukin 6 is shown to be an acute phase pro-inflammatory cytokine responsible for the synthesis of the CRP from the liver. So the interleukin 6 goes up in response to inflammation, and again, it drives inflammation further. That then causes C-reactive protein to increase because the liver causes the liver to increase the production of CRP, and that which helps to clean up the debris and destroy cells. So if you have tissue damage, cell damage, your body's immune system kicks into overdrive. That creates more interleukin 6. that creates more CRP. And a lot of people have heard of CRP, C-reactive protein. It's a common blood work marker that you look for in inflammation. So CRP itself is not a bad thing, but when it's high, it shows you've got inflammation in your body. So when you start to reduce the inflammation in your body, whether it's nutrition, lifestyle, stress, chiropractic care, all this stuff, those things all start to turn down. So the immune system response turns down. You're getting less interleukin-6, you're getting less CRP. Blood work shows you're getting less CRP, you have less inflammation in your body. And then also just a side note, most patients that reported that symptomatically they felt better over those 2-week period also. So I think there might be one. Oh, and just a couple other things we do aside from the adjustments that can help reduce inflammation is cold laser therapy and acupuncture. They both do kind of similar end results, but in a much different way. Cold laser it increases the mitochondria action in the cells. So when the mitochondria is the energy driver of the cell, so it creates cell reproduction at a faster rate, so you can heal faster. We've actually shown even like cuts and things on your skin running the cold laser, or it speeds up the healing of that tissue. So I think that was about all I had. Just going to touch on that.
All right, I'm gonna speed up a little because I've gotten longer than I thought. I can't believe we're already 45 minutes in. So herbal supplements, just real quick, I'm just gonna hit on 2. Turmeric, everybody's probably heard of this one. It's very, very common and tons of benefits to it. So again, you need to make sure you're taking a good quality one. And also usually having something in there to help with the absorption is a good idea. So black pepper, fenugreek, and piperine are usually the most common ones. The active component in turmeric is actually your curcumin. Dosage depends on the quality of the supplement. I mean, the one we use usually, 200 milligrams, a lot of times seems to be enough. I mean, other people, people bring in on muscle test them and they'll have to be taken like 1,000 or something of what they are having. So that's usually telling me it's not quite as good quality. So turmeric forte, this is the one we've just kind of used in our office for quite a while. Like I said, most people get by with 2 tablets a day, and it's very affordable at $42.50 for 60 tablets. So does anybody have questions on this? It's pretty straightforward. And turmeric is just, it helps resolve that inflammation. It supports that anti-inflammatory factor, kind of on different than omega-3. So it's actually kind of decreasing the inflammation a little bit, but it's still not blocking the inflammation like our NSAIDs. So
Do you, we eat a lot of turmeric. I take a
Yes.
supplement too, but
yes,
is there actual benefits
Oh,
to the amount we're consuming? Okay.
yes. There's still benefit to getting it anyways.
Okay.
Yeah. So yeah, you guys, most of my patients know my microbiome mash. I always put turmeric in it. So it's just kind of, you put it, yeah. So it's always in my smoothies and things like that. But yeah, definitely
I
benefit.
snuck it in dinner last night.
Yes.
It's so tasty.
Yeah, and working it into your diet, if you're healthy and don't have a lot of inflammation, is a great thing. Yes, if we have inflammation, we're needing to get under control. That's when we need higher amounts in supplement form. So
What is turmeric? Is it a herb?
it's a root. It's like a root. It almost looks like ginger.
Oh, okay.
Yeah, it kind of looks like ginger. It's in
Yeah,
the
picture of it on.
Is it
Oh,
in
yeah.
any other food?
Oh yeah, it was right there. That's it.
Looks a lot like ginger.
Yeah, you can get it in the health food store, just already ground up. You can get it as the root. You can get it. Yeah, you
I
can cook with it.
my meat.
Yeah.
I cook hamburgers.
Yeah, you were the one that
Yeah.
says you've started using it a lot. Yeah. So it's just, and it's used in Indian food, right?
Yeah.
Indian food a lot. So, yeah, so that's just tons of benefit, not only for joints, for brain, for liver, for everything. So it's just one that's very beneficial for everybody to take. And then Boswellia, this is another one, another name it goes by is frankincense. So again, been around forever. But this one is specifically really good for not only gut inflammation, but also joint inflammation. But helps improve digestion, blood circulation, pain management, cognition. So another great one to use. So this is the one that this one is better absorbed with fat. So taking it with the fat, you will absorb it a little bit better. So turmeric Boswellia C, this is actually a brand new supplement. I just ordered it today. So it actually has both the turmeric and the Boswellia plus some vitamin C in it. So it kind of helps support joints, antioxidant, synergistic blend, and helps a little bit with blood sugar too, because it also has ginger in it. So I like this because I'm finding more affordable things. Things are getting very expensive. So I've been kind of looking for high quality, more affordable things. And this is going to be a really great one for people. So just one capsule twice a day, and it's like $40 for 90 caps. So like I said, I've got some of this actually coming in. So And this is a new company that I'm starting to use called Doctor's Research. They are all whole food nutrition. They just they make them a little bit differently. And so it's a little bit more affordable, but I've been really impressed with the results we've been getting with people and the way people are muscle testing with them. And a lot of other doctors have started using it and we really like it. So. All right, common blood tests. These are just blood tests that can kind of be indications of inflammation. CRP, C-reactive protein, is going to be more your vascular inflammation. Homocysteine, if you're going to have elevated homocysteine, it usually has to do with you're not able to methylate properly. It can have something to do with something called 5-MTHFR gene mutation. So I'm not going to get into that, but that's just kind of what it usually has to do with. White blood cell count being elevated can be also an indication. Uric acid levels being up. Of course, that can cause inflammation. Elevated cholesterol, low vitamin D. So if you're inflamed, you're going to burn through your vitamin D really quick. So if you have chronic low vitamin D and can't get it up, it's either you're burning through it too quick or you're not absorbing it in your gut. So those are one of the two. And consuming wheat for a lot of people blocks your absorption of vitamin D. So, and then your omega-6 to 3 index is just another indication. So, okay, so we're gonna talk real quick. This is the omega-3 index plus test. So it is a blood test that measures the percentage of omega-3 fatty acids in the red blood cell. So it is just off of a finger prick. And what they found is by doing that, it's more stable. So if you're doing it off blood, it can be more affected by what you just ate if you just took your fish oil supplement. If they're doing it off the finger prick, it's more stable as to what's actually in the red blood cell. So that's the benefit of doing the finger prick over the blood. So it's just a convenient test. And for anybody that's interested, we can do this tonight. Cost is usually $80. For all of you that came tonight, you get 50% off. So that will only be $40. If you are watching online, I forgot to mention this earlier, make sure and comment on this live to get the 25% off. So we'll reach out to you on that. And then I do want to mention we've got our 10-day sugar detox program starts July 10th. This is kind of where we run it on Facebook. So this is run by me, Dee Dee Lopez, and Micah is back there. So Dee Dee is our personal trainer. Micah is our health coach. So then I kind of do the education. So we just kind of do it together. We've done tons of these programs where we just kind of educate you, get you focused and motivated and kind of keep you on track. So we'll be focusing, of course, on getting the sugar out, also eating real whole foods, and just kind of getting on track. So getting things moving in the right direction. And of course, we'll probably throw in a little bit more inflammatory information on this one. So so you can get signed up for that. It's only $30 per person for that. New testing available. Last thing I wanted to just mention real quick. This is a brand new test that I'm starting to run in our office. It is actually a genetic test. So it's called Reveal My DNA. I'm very impressed by the reports and the amount of information that you actually get about your body. It is telling us what type of exercise you need to do, how many times a week. It's telling us a lot about brain health. It's telling us, are you thyroid? It's telling you, do you have a tendency not to convert your T4 to your T3? And it just goes on and on. The reports are like 100 some pages long. So tons of great information. So this is just something, like I said, just new. It's just a quick cheek swab. It costs us $350. So I just wanted to throw that in there real quick. So I probably am going to start talking to people about
I've
that.
done something similar to this and it is amazing.
Yeah, and I did mine. I always drug my feet on the genetic testing because I'm like, your genetics are there's genetics and then there's epigenetics. Epigenetics is how your genes are expressed. Is your lifestyle is what expresses your genes. So I'm like, what is your DNA going to really tell you? But it really told me more than I thought. It's like I did mine. And I was shocked to me. It said, I don't convert T4 to T3 very well. It's like, yeah, my T3 is always a little bit low. Sleep. If I have to have sleep or my brain doesn't work. And that's exactly what it said. The other one that I found really interesting is alcohol. I've been one, if I drink any alcohol past 6 o'clock, I don't sleep. Literally don't sleep. And I could never understand it. And this basically said, don't drink alcohol after 6 o'clock. I'm like, are you kidding me? I'm like, so I mean, it just confirmed so many, and also said I need to do 30 minutes of cardio 5 times a week to balance my mood. And I'm like, yeah, I already kind of knew, but I was like, yeah, it's right. So I was impressed. So I was impressed by it. So All right, so I am finally done, guys. Sorry, I got a little long-winded than I expected to. So, all right, if anybody has any other questions there online, go ahead and just put them down. We'll get them. Did we have any questions, Jackie, or anything? Okay, all right, we're gonna line up. Okay, let me just go ahead and turn this off real quick.
I was trying to think of the company that you used to use, or do the blood draw, Boston Heart, is that it?
Yes,
They did the genetic.
they did do just like the
difference in